Hi, welcome to All Day Academy. Let's talk about heart health. Coronary artery is an artery which supplies oxygen and nutrient to the myocardium, which is the muscle of the heart. The heart beats about 100,000 times each day. According to WHO regarding the causes of death in Malaysia, 36% are due to cardiovascular diseases and 15% are due to cancer. Cardiovascular diseases are the number one cause of death globally. More people die annually from cardiovascular diseases than from any other cause. An estimated 17.7 million people died from cardiovascular diseases in 2015, representing 31% of all global deaths. 80% of all cardiovascular disease deaths are due to heart attacks and strokes. 7.4 million deaths are due to coronary heart disease. 6.7 million deaths are due to stroke. Most cardiovascular diseases can be prevented by addressing behavioral risk factors such as tobacco use, unhealthy diet and obesity, physical inactivity, and harmful use of alcohol. People with cardiovascular disease or who are at high cardiovascular risk due to the presence of one or more risk factors such as hypertension, diabetes, hyperlipidemia, or already established disease need early detection and management using counseling and medicines as appropriate. Heart disease doesn't run in my family, therefore I have lower risk. This statement is false. Women equal men in the prevalence of heart diseases. True. 50% of men and 64% of women who have had a heart attack show no symptoms of heart disease before the attack. 15% people don't survive heart attack. 20% people die in a year following the heart attack. Types of heart diseases. There are various types of heart diseases, including valve disease, aneurysm, coronary artery disease, cardiac arrhythmia, heart failure, cardiomyopathy, pericarditis, and so on. Among the causes of death due to cardiovascular diseases, coronary artery disease contribute to the highest prevalence of death, followed by stroke and other cardiovascular diseases. Coronary heart disease involves the disease of the blood vessels supplying the heart muscle. Cardiomyopathy, arrhythmias, stroke, rheumatic heart disease, congenital heart disease, aortic aneurysm and dissection, peripheral artery disease, deep venous thrombosis, other cardiovascular diseases. Common treatment regimen for heart diseases involve medicines such as aspirin, beta blockers, ACE inhibitors, and statins. More costly surgical operations are sometimes required, such as coronary artery bypass, balloon angioplasty, valve repair and replacement, heart transplantation, and artificial heart operations. What are the risk factors of cardiovascular diseases? Age, sex, family history, hypertension, diabetes, high cholesterol, obesity, lack of physical activity, and smoking. Malaysians has high prevalence of diabetes compared to other countries. Malaysians are considered the most diabetic in the Southeast Asia region and rank 6th in the Western Pacific region. WHO's report shows that Malaysia ranked 6th among ASEAN countries with high obesity. Malaysia has the highest percentage of overweight adults in Southeast Asian countries. The prevalence of hypertension in Malaysians keep on increasing every year. Generally, a large proportion of Malaysian sources of calories come from refined and processed carbohydrates. Common heart attack warning signs. Locations of chest pain during angina or heart attack, such as upper chest, left shoulder, neck and jaw. Pathophysiology. The plaque formation progresses over many years. Plaque formation starts with oxidation of LDL. When the LDL is oxidized, it penetrates into the deeper layer of endothelium. The white blood cell sets in to eliminate the oxidized LDL. Fatty streak starts to form. Fibrous plaque starts to build up. Eventually, the fibrous plaque ruptures and attracts more white blood cells and other mediators to form thrombus. When the blood clot happens in the heart, it causes heart attack. When it happens in the brain, it causes stroke. When it happens in the lower limb, it causes gangrene. When it happens at the kidney, it causes aneurysm. There are many reasons that contribute to coronary heart disease, including reduced blood supply and impaired blood vessel activity. Free radicals, oxidized LDL, chronic inflammation, homocysteine, plaque formation all contribute to coronary heart disease. The debate continues over the efficacy and rational use of statins. Half the people with heart disease have low cholesterol. Half the people with healthy hearts have high cholesterol. Cholesterol can be divided into VLDL, IDL, LDL, and HDL, according to their particle sizes. Cholesterol is being synthesized in the liver and being excreted through the bile duct into the small intestine. From the small intestine, about 90% of the cholesterol is being absorbed back to the bloodstream. LDL and HDL cholesterol. What is inside LDL? LDL contains triglyceride, which store calories to provide energy for the cells. Cholesterol is the building block for the membrane of the cells and hormones. Lipoprotein brings cholesterol to areas of blood vessels with lesions. The cholesterol is being utilized to repair the injured areas. HDL brings back the excess cholesterol to the liver to be eliminated through the bile duct. Statins. FDA approved the first statin in year 1987. The global market size of statin will reach USD 12.2 billion by year 2018. Statins have many side effects, including muscle pain, skin rash, sleep problems, stomach bloating, and so on. A Finnish study found that statin drugs decrease antioxidant levels by 22%. Statins can lower coenzyme Q10 levels by up to 40%. Another study shows Zocco increases insulin levels by 13%, which increases the risk of high blood pressure, type 2 diabetes, insulin resistance, and obesity. Cholesterol-lowering drugs lower cholesterol, but they did not decrease death from heart attacks. The risk of low cholesterol levels. If the cholesterol level drops below 160, the risk of depression will increase. Lowering the cholesterol level increases the risk of Alzheimer's disease, neurological disorders, depression, suicide rates, and death rates. Cholesterol is being synthesized in the liver through a process which involves HMG-CoA reductase enzyme. Statins block such enzyme activity. In the process, the production of Q10 and prenylated proteins are also being halted, which leads to the muscle weakness. Framingham Heart study shows that lowering LDL level reduces the mortality rate. The Framingham study shows that high level of HDL are directly related to lower risk of heart disease. It shows that increased HDL level could reduce coronary disease independent of LDL. Triglyceride HDL cholesterol ratio. Many studies have found that the TG over HDL ratio correlates strongly with the incidence and extent of coronary artery disease. This relationship is true both for men and women. One study found that TG over HDL ratio above 4 was the most powerful independent predictor of developing coronary artery disease. Therefore, it is very important to reduce the TG over HDL ratio. A year 2011 study shows that there is a strong relationship between serum Tg elevation and increased levels of high blood glucose. A study in year 2010 shows that high Tg and low HDL cholesterol levels were associated with coronary heart disease even in patients with lower LDL cholesterol levels. High Tg is associated with 70% increased risk of coronary heart disease. High Tg is associated with type 2 diabetes, insulin resistance, and metabolic syndrome. Triglyceride is associated with VLDL, which is the contributing factor of arteriosclerosis. High Tg causes difficulty in transporting other lipid particles, especially VLDL, out of the circulation. Tg is very responsive to lifestyle change. If HDL is lower than 60, the risk of heart disease will increase. Hydrogenated fats such as margarine depresses HDL and raises LDL. Niacin is effective to increase HDL by 15 to 20%. How to reduce Tg over HDL ratio? Exercise and reducing body weight are very important. Reduce alcohol intake. Reduce consumption of refined carbohydrate including high fructose corn syrup. Replace saturated fat in the meat with mono and polyunsaturated fat which are found in the plant-based diet. Take omega-3 daily. Supplements useful to reduce Tg over HDL ratio. Omega-3 fish oil reduces triglyceride by up to 30%. Chromium improves insulin sensitivity. Niacin can reduce Tg up to 40%. Fibers such as chia seed, flaxseed, psyllium husk, and bran reduces triglyceride and increase HDL. Supplements for heart health. Omega-3 reduces inflammation and prevents clotting. It reduces triglyceride up to 30%. Coenzyme Q10 lowers LDL's affinity to stick to the blood vessel wall. Coenzyme Q10 reduces adverse drug reactions of statins such as muscle pain and weaknesses. Red yeast rice and beta-glucan reduces cholesterol level. Red yeast rice contains HMG-CoA reductase inhibitors. It also contains sterols, isoflavones, and monounsaturated fatty acids. Vitamin B. Folic acid, vitamin B6, and vitamin B12 reduce homocysteine. Niacin increases HDL and lowers triglyceride. Homocysteine is being synthesized from methionine, a kind of amino acid found in meat. High level of homocysteine is associated with arteriosclerosis and blood clots. Vitamin B12, folic acid, and B6 reduces the level of homocysteine. Vitamin E helps to prevent blood platelets from sticking together. Garlic preserves elasticity in blood vessels. Flavonoids reduce the inflammation associated with heart disease. Flavonoids strengthen capillaries and act as powerful antioxidants. Low level of vitamin D is associated with higher risk of developing cardiovascular diseases. Low level of vitamin D is associated with higher risk of developing diabetes, obesity, high blood pressure, and high cholesterol. Vitamin C and collagen participate in several important functions in the vascular bed in support of endothelial cells. In conclusion, to reduce the risk of coronary heart disease, we need to modify the lifestyle and diet. Plant-based diet and exercise greatly reduce the risk of coronary heart disease. Antioxidants are very important to reduce the free radicals. Fish oil prevents platelet aggregation. Antioxidant reduces arteriosclerosis. Antioxidants reduces chronic inflammation. Neurotech, which contains B1, B6, B12, and folic acid, reduces the level of homocysteine. Vitamin C and collagen preserve the integrity of endothelial cells. Prevention is better than cure. Thank you for watching.